Hello, my name
Hi
is,
there.
how are you doing?
Good, thank you.
Awesome. My name is Okafor, and I'm the co-chair of the 10th edition of the Oxford Africa Conference this year. And I have the pleasure of welcoming Mark Suzman, who's the CEO of the Bill and Melinda Gates Foundation. Mark started his career as a journalist during apartheid in South Africa, where he covered the historic 1994 election of Nelson Mandela. In 2000, he joined the United Nations, where he was a senior advisor to the Secretary General Kofi Annan. He has served in many senior roles at the foundation since 2007, including building the foundation's global offices in Africa and elsewhere, and was appointed CEO just over a year ago as the pandemic struck. He also holds a doctorate in international relations from Oxford. Mark, welcome to the Oxford Africa Conference.
Thank you so much. It's a great pleasure to be with you.
Awesome. Now, Mark, you're already aware, but the conference theme this year is Rewriting the African Story and Asserting Africa's Future. And my co-chair and I chose this theme because we believed it was important to use this platform that the Oxford Africa Conference has as the largest convening on Africa in Europe to showcase the excellence that occurs across various industries on the African continent. We were also united in our decision to ensure that we were not focusing too much on the many issues on the continent, but instead driving solution-oriented discussions that I hope that we'll have with you this morning. Now, in that vein, in 2016, the Bill and Melinda Gates Foundation announced a $5 billion five-year investment to support health and anti-poverty initiatives in Africa. Now, 5 years on, can you discuss the impact of those initiatives and how they have enabled people across the continent to rewrite the African narrative and assert their future?
Yes, so we've actually been investing in and with Africa since we were founded in 2000. But that commitment made by Bill and Melinda 5 years ago was linked in large part to an expanded presence on the continent, where we now have offices in Ethiopia, Nigeria, and South Africa, and operate in nearly every country in Africa. And it was in part a recognition that the work we could and should be doing is helping support African-grown initiatives and priorities, but in specific areas where we as the Gates Foundation might have technical expertise. So that includes healthcare in particular, but also agricultural development, financial inclusion, areas like that. So over the last 5 years, those investments have included significant support, say, to AGRA, which is an organization that works across Africa to support agricultural development priorities, because we know that the very poorest of the poor are still rural farmers for the most part, men and women across the continent. But we know that there are concrete ways to both increase productivity, increase income, which helps invest in the next generation of human capital in Africa, and that's why we prioritize that. Similarly, in health, there's been great progress in vaccine distribution, in treatments, in primary healthcare support, which are the key areas where we work. And again, we do some of this at a direct level. For example, in Nigeria or Ethiopia, we work very closely with the respective ministries of health at both a federal and a state level to help build and strengthen the capacity, whether it's training of health workers, whether it's the improving of supply chain. So all of these are very concrete steps that we've seen massive progress. Obviously, some of that has been challenged in the past year with the pandemic, but overall, the lesson has very much been that an African-led vision of investing its own people is one that the Gates Foundation is very proud to keep supporting.
Yeah, I think that's a brilliant point that you raised there, Mark, that the difference in the approach that the Bill and Melinda Gates Foundation has to invest in African partnerships and ensuring that the African experts and top talent are able to sort of feed into these solutions that facilitates a bottom to top approach. And that means that, in terms of connecting it to our theme, Africans are able to sort of speak to rewriting that narrative. But I would like to sort of now look at how the pandemic has sort of affected these areas and how the Bill and Melinda Gates Foundation has planned accordingly to help in that regard. And this year has been extremely unique and quite a tasky one. And Mark, I'm sure you can testify to that because it's the same year that you were appointed the role of CEO of the foundation. But in relation to Africa, to date, approximately 21 million doses of COVID-19 vaccines have been administered in Africa, and this is home to more than 1.2 billion. And I would like to ask how the foundation is addressing global vaccine inequities. Maybe could you expand on the foundation's work and their role specifically in relation to the COVAX initiatives?
Yeah, so let me talk about the COVID crisis broadly and then come back to the very critical issue of vaccines. So actually my very first act as CEO, external announcement, was to announce in February of last year, very first external act, a set of investments with the African Centers for Disease Control and Prevention, which we helped set up or provide some of the initial technical support after the Ebola crisis to help them before there was a single case of COVID outside of China, to help build their capacity to help support African countries have diagnostic testing and treatment facilities. At that time, only 2 African countries did, South Africa and Senegal. And the African CDC was able to take those resources very quickly and use them very ably. And actually the role of the CDC over the course of the year is just one really powerful example of how African institutions have come in and supported an African-led response. Similarly, there's an initiative set up under the auspices of the AU called the African Medical Supplies Platform. And we've tried to provide, again, technical support and financial support into that to help them with, for example, the purchase of dexamethasone, which has been the one proven steroidal treatment and its distribution across Africa. And we're in ongoing discussions about how we support the next phase of all of that work going forward. On the vaccine front specifically, what we did was a couple of things. First, we were founders, along with several governments and a couple of other philanthropic partners, of both what's known as the Act A, which is the broad umbrella framework that looks across treatments and diagnostics and vaccines, and specifically the COVAX initiative. And the COVAX initiative, when it was set up, was intended and still has an element for what's called its AMC 92 countries, which includes most of Africa, to pool resources to be able to purchase at scale vaccines when they were proven to be effective for distribution in an equitable way across Africa and the rest of the developing world for at least the first 20% of the population. And we made a significant financial contribution to that. Clearly, that has not happened in the way we hoped. What has happened is that rich countries have gone through multiple bilateral deals and have essentially scooped up most of the available supply and left COVAX with very little available. I would note that the doses that you talked about that COVAX has made available to date, at least until very recently, were largely vaccines manufactured from the Serum Institute in India through a partnership that we helped broker and actually provide the bridge financing for with Gavi, the Vaccine Alliance, and through COVAX last September. And it's that supply that has led to the first wave that came through in Africa and elsewhere. But unfortunately, because of the nature of their crisis, India has now stopped exporting those vaccines. And so COVAX has had to look for other sources of supply, at least in the next few months. And we're actively helping with that too, trying to see from other suppliers what we can do and at what cost we can bring that down to. But again, where you started, the bottom line, I think it's 4 out of 5 doses of the first billion vaccines have gone to people in rich countries. And I think it would be around 2 of 1,000 have gone to people in poorer countries. And that is just absolutely unacceptable at every level. So as we redouble our efforts, what we're looking at now is both continuing to push for the financing. So COVAX has the resources to compete and purchase those vaccines and in its pooled way and provide them to Africa and other developing countries. We are actively pushing wealthy countries to move to much more aggressive dose sharing. They have more than they need, many of them, and they should be supplying that to Africa and other parts of the world. And then last but not least, we need to start thinking about the future. And maybe we can come back to that, which is say, how can we make sure that something like this never happens again, that we don't get these kind of inequitable outcomes? And that does include a need longer term investments in regulatory support, in domestic manufacturing capacity in Africa and again, other regions. And we're also fully engaged in discussions there. So at every level, we've been trying to support African institutions at both the continental level and also the regional and national level. But as you say, the reality is we are in an unequal world, and we are seeing that inequity facing Africa yet again. And that is both outrageous at one level, but it is a call to action at another for how we can all come together to address it.
Yeah, I definitely agree with that, Mark. It is a great point that you raise again, and a good moment to raise a call to action, because on one hand, you are seeing arguably the greatest sort of collaborative global effort this year, but also with these numbers that you've shared. And I'm a scientist, so I like to sort of churn data. I think it was 83% of the first billion doses going to wealthier countries, and 0.2% going to low income countries. And I think we sort of maybe on the back of the progress that we have made with these very many sort of regional and global efforts, need to also understand sort of the ramifications that can occur if there are outbreaks, or we're also hearing news of new sort of variants and strains occurring too. So it's a good point there. And I'm sure you'd also agree that COVID-19 not only sort of raised the veil, if you like, on many of the existing global issues, but also exacerbated that, the inequalities to say. For example, pre-COVID, 1 in 3 women would have undergone gender-based violence by their intimate partner. And data shows that post-COVID, that's only intensified. Another point, Bangladesh, one of the countries who were actually pre-COVID had achieved poverty alleviation, and now, post-COVID, have welcomed 20 million plus individuals into what is being cast as the new poor. Now, on the back of that, and again in the African context, what do you see to be, or envision to be, some of the consequences to the delays in vaccine access across Africa? And how is the foundation proactively addressing these issues?
Yeah, so first, again, on the wider development issue, it's important to recognize and remember that over the first 2 decades of the 21st century, much of Africa has performed very well, not just economically, but actually socially. There are a number of countries, from Tanzania to Ghana to Malawi to Ethiopia, for example, met the Millennium Development Goal target in 2015 of reducing child mortality by 2/3, of reducing poverty by half. That progress and momentum continued. There are some countries it hasn't, but there are many, many they have, and across the continent they have. And really that momentum now got heavily stalled in the last 12 months because of COVID. Just the economic consequences, both of a global shutdown, national shutdown, and particularly the consequences for women, we still don't fully have the data. You're a scientist, you're looking at data. We are working hard to get that data, but we know the consequences are real. So we need to address them. But I do want to underline that our starting point is of a model where actually many, many African countries have shown what to do and how to do it. Some of their expertise that was shown in the early days of contact tracing and testing, especially in parts of West Africa that experienced the Ebola crisis, was far more sophisticated and successful than what many Western countries managed, because African countries have learned how to do that out of necessity and have driven and have that ingenuity, and that we have the systems and the structures in place to build on. But now, what does that mean going forward? Well, we're looking at it in multiple ways. One is a redoubling back on some of those initial things we talked about, like agricultural development. That is the core engine of poverty reduction for the very poorest, and it is an engine of economic growth. It provides income, it provides nutritious foods for children, and so it's for us a sort of multiple win-win, and it's important that the continent and countries continue to prioritize that. You mentioned gender, and I think that is critical, and we've actually just recently set up a full gender equality division as a complement to all of our other work, because we see this as fundamentally integrated. If you take that agriculture example, I can do all those statistics, but we also know that 50% of the labor on farms is women. We know that women have less access to credit. They're less likely to get access to extension services. They have more household duties. They often have smaller plots of land or less likely to have title to the land. Unless you address each and every one of those component parts, you're not addressing the big picture. And you can look at that across financial inclusion, and then you can look at that across the rebuilding of essential health services, where, again, a lot of great work has been done. We had to pause a number of vaccine campaigns. Obviously, during the COVID time, we were worried about some of the impact, particularly for malaria, because malaria is a disease that requires you to come in contact with a treatment rather than isolating yourself. But again, we're looking at statistics. The data is worrying, but it's been very encouraging to see how countries have been leaning in to sort of follow up, and we are actively supporting that as well. And there have also been some new tools that have been accelerated. We know that some of the digital financial inclusion tools around social payments to people through mobile phones, which had already started, and there were powerful experiments going on in places like Kenya and Tanzania and others, those have been accelerated. We have new platforms to build on, and we need to make sure that those are redoubled. So it's sort of a both and. You've got to address the specific challenges that were out of COVID, and that means staying focused on the COVID response, including getting the vaccines and the other healthcare that is needed, and being continually on the watch out for variants or other upsurges that we've seen tragically in India in recent months. But it also means staying focused on the big picture of investing in the resources and the tools that are needed to help the African continent lift itself up.
Yeah, I think that's again, a fair point. And I think I like the perspective of, yes, acknowledging that there are very many unraveling issues that have occurred as a result of the pandemic. But in that, Africa being able to have handled the same sort of public health issues with Ebola, and having those systems in place and reacting quite quickly to that. And I think highlighting that is very important. And again, all these sort of innovative initiatives that have risen out of that in the continent. And I think maybe just as sort of an add-on to that point, what play, again, speaking to the Foundation's approach to investing in African partnerships, are there any sort of other partnerships or sort of local talent that the Bill and Melinda Gates Foundation has partnered with recently that you'd like to share?
Well, we have a range of things we do at sort of national and regional level. Maybe if I keep just, and we've got examples in basically all the areas we work, but let me use one which has become very live as a result of the COVID discussion, which is we have been doing for some time through our work supporting, say, polio eradication, where Africa did successfully eradicate wild polio virus a year ago, in malaria and other tools, to see if we can help build and strengthen laboratory capacity across Africa to conduct, tests and treatment. And that's both an end in itself for each of those diseases, but also capacity that helps countries and the region build much stronger and more sophisticated, health systems. Everyone's now become familiar with you. You need to be able to do the pathogen sequencing. You need to be able to then put that data into the health system. You need to be able to form that response. So I think there's a real opportunity. We're again working with the African CDC and the African Union and multiple countries to now see how can we do a both and. And as I said, well, what is it about building national level capacity around African laboratories and regional capacity that will be supported by the World Health Organization, AFRO, and the Africa CDC to both directly address some of these diseases and to provide public goods for the continent and indeed the world going forward. So, and that's kind of a model of how I already cited AGRA as one of the areas we work in for agriculture. And similarly, we have an initiative, a partnership with the African Development Bank right now around African Financial Inclusion Initiative, which again, in each case is trying to take a set of best practices that we might have developed in one or two countries where we've been working and see if we can work with strong African partners like the AFDB or the African CDC to help sort of spread those across the continent. So it's a model, we're always learning by doing. I certainly wouldn't claim that we've got it right. We're also trying to do a lot more about some of the longer term capacity building we do, because we're a very results focused organization. And so I sometimes worry that some of our investments be so focused on what can be done right now, we're often not thinking about. So it's just getting these antiretroviral drugs for HIV out to the people who need them, that it's been slow to think, well, are we making sure that the supply chains that we're helping the countries develop are actually going to be supply chains that work for other essential medical supplies or other tools? And are they fully owned and driven by those countries in a consistent way? And I think we've been making progress, but that's a real, for me, a top priority going forward, to take those core examples and build on them.
And I think just speaking to that and connecting it to your career, Mark, you were a young journalist that actually witnessed a watershed moment in African history, the release of Nelson Mandela and the end of apartheid. So one would assume that you had insight into the evolving of the African narrative over time. And as you've worked to address social injustice, equity and development, can you maybe dive into that formative experience and maybe speak to how that African narrative has evolved over time, and what encourages you as you look to the next generation of leadership voices, particularly the voices of women emerging across the African continent?
Yes, well, obviously the election of Nelson Mandela in 1995 was a true turning point for the world as a whole. And it was an amazing privilege as a young journalist to be there. And even though we all now take it for granted, I do think that was an example of amazing personal leadership, along with things that Nelson Mandela is these days so elevated as a saint that people tend to forget what a practical, thoughtful political leader he was, and able to build bridges, to build alliances, not just across black and white, but between different groupings, different political factions. And the way in which he did it was a kind of inclusive, thoughtful engagement. Now, did that solve everything? Absolutely not. Did it lay a platform for solving them? Yes. We know there are deep, deep inequities that remain in South Africa and across the continent. And so part of what watching that helped generate for me was the demand that has shaped my career of how can we go in and try and systematically address those, but address those in a way that have to be African-led and driven, that, however well-intended philanthropic resources like ours may be, or donor resources might be, they simply, cannot work unless they are driven, owned, led, internalized, and supported by leaders and the people themselves against their own priorities and needs, and that are building that long-term capacity. And so taking that bridge, how you do it is almost as important as what you do. And actually, the foundation was privileged enough to have Nelson Mandela and Graça Machel visit. At one point, we have one of his famous shirts up in our boardroom as a result. And Graça Machel has been a long time, mentor and friend and partner for me since then, when you talk about the role of women. And we've worked closely with her. And one of the pieces of advice she gave us as the foundation when she came to visit us, I think about a decade ago, and I was interviewing her, which I've tried to make a hallmark of how we operate. And, it may sound kind of soft for a foundation that has a reputation as being very hard-edged and technocratic, but it's simply listen with respect. And for me, that listening with respect, when you're combining it with the technical expertise, say, we have and build in health or agriculture or sanitation or financial inclusion or education or whatever it might be, you've got to connect the two, because ultimately it's about helping human beings take and drive a path. And that, to pull it back to Nelson Mandela, is one of the fundamental leadership traits that he was almost supreme in. It's recognizing that we are all human, including him, and that you need to have a human vision that resonates along with practical outcomes. And so again, it's not a balance one ever gets right, but I think that is, for me, the vision that's taken and inspired me, and what I see and hope will come through the next generation in Africa. And it absolutely has to have gender and women leaders very much at the heart.
For a young woman, an African woman at that, who is very sort of passionate about women in leadership. It's great to hear you say that, Mark. And I do think that sort of incorporating the perspectives of youth in the way in which Africa decides to rewrite its narrative is imperative as well. And I very look forward to seeing the T-shirt of Nelson Mandela one day in the boardroom. But yes, thank you so much for sharing that. And I'd also sort of want to maybe add in as a final point and question, but specifically the area of agriculture, particularly because that's an area that I have an interest in as an owner of a social enterprise that caters to women and youth. I wanted to find out and hear a bit more about the foundation's take. I know that you've already sort of dived into that, but maybe if we could hear some more of from a gender lens perspective again, the way in which the foundation has worked with women in agriculture and also to overcome food insecurity. I know that you're already doing work in Kenya in that regard.
Yes, so as you say, I cited some of the bit because it's one of those bits where agriculture often just sounds like it's a technocratic approach. Surely this is just about having more productive seeds and more productive soil and more productive techniques. And we know it's not that. That is a critical element, and we do invest in all of that. You know, we are major investors, for example, and this is where climate change intersects heavily with agriculture, in how can you get more drought and flood resistant crops for some of the crops that are very important to Africa, but don't get a lot of global research, like cassava or crops like that. And we also want to make sure that you do have these sort of tools, techniques, operations, like I mentioned, the extension services. So to take one historical example, when we were mapping extension services, we often found that extension services don't go directly to women when they need to, that they often, even if they're half of the farmers, they're not necessarily those who get access. And extension service, again, for those who don't know the term, that's just simply the training, the best tools, how to plant, how to think about your soil and fertilizer makeup, which seeds to use when, or how to think about water use, and it helps with productivity. And so what we've done is worked with national agricultural research institutes and national ministries, both ourselves and then directly through AGRA, to say, well, how do you make sure that you're taking special care to focus on women farmers in that particular case? Or similarly around the financial access point I mentioned about access to credit and access to title. So in order to these, some of these we do directly, some of these we do indirectly through partners, but that's how we try and integrate it. And then back to your data point, one of the challenging bits has been how little data there is around that. It's actually when we were trying to map out, and not just we, with other partners, trying to map out exactly what the gaps were in terms of financial access to credit or land ownership by gender. It's very difficult to find those out. And so that's where you need some broader public good investments, which should be well beyond what the Gates Foundation does. And then we've also done direct investments in agricultural women scientists and others, so that you're back to your point about leadership. And there's an important moment coming up next month, which unfortunately hasn't had quite the visibility it's supposed to have, called the Generation Equality Forum, which is the anniversary of the Beijing Women's Conference about gender. And within that, I think there's a whole element of leadership and women in leadership, of which for us, the support of women in leadership in agriculture is a critical component. So hopefully that gives you a flavor. We'd love to have you over to the foundation at some point so you can meet our very passionate team or see some of our work in the field around that. But to end where I started, there's simply, it is a mathematical fact that you cannot meet the Sustainable Development Goal around poverty reduction and agricultural productivity improvements unless there is a deliberate targeting of women farmers in a special and dedicated way on top of the core investments. And so that's something we've had to retrofit. We were probably a little naive about it early in our journey on agriculture, but it is now at the heart of everything we do. We look at every single grant we make and assess it for its gender sensitivity and whether it has a particular role. And I won't claim we're all the way there yet, but it's a very sincere acknowledgement that that is a fundamental part of the issue, and pulling back to the continent as a whole. while agriculture is critical because of the size, that same gender focus needs to be true in education, in financial inclusion, and sanitation, and all areas of leadership beyond the ones that we work on directly. And so hopefully you and your generation will help make that happen. And we look forward to supporting you do that.
Brilliant. Thank you so much, Mark, for taking us through that. I think in terms of just covering the conversation, you know, hearing from you about how the African narrative belongs to Africans, and the rewriting, redrafting, reshaping of that it lies in the hands of youth. And it seems that the Bill and Melinda Gates Foundation is very intentional in the way in which they partner with local talent on the African continent to make that happen. And it's also great to hear you also speak to women in leadership and the importance of that to achieve the SDGs that we're all sort of very eagerly looking at making happen. And also that you sort of have the task of putting the vision of Bill and Melinda Gates Foundation, which is ensuring that everybody has a productive and healthy life. And you cover that through key investment areas, which are agriculture, health, and financial inclusion. And for that, I think that's a good way to end. Mark, thank you so much for taking the time out to speak to us at the Oxford Africa Conference. And I hope that the suggestions, solutions, and the points that you've noted here today will remain a future reference point for the rest of the African generation to take on and implement. Thank you.